So in this section, I'll be talking about different tests that your doctor might want to order after having a seizure or even establishing a diagnosis of epilepsy. The first is EEG testing, electroencephalography. There's different sorts of EEGs. The most basic one that most people will have first is what's called a routine sleep-deprived EEG. We sleep-deprive children for a couple of reasons in doing an EEG. First of all is we want them to fall asleep during the EEG test, as there's some sort of abnormal electrical activity which may come out more during sleep, which we might not see during wakefulness or drowsiness. The second reason is we want to stress the brain a little bit so that if there is any part of the brain that's irritable and prone to seizures, we'd be more likely to see the discharges. A second sort of EEG is a prolonged EEG. There's a couple ways this can be done. It can be done as part of an inpatient video monitoring. That's where you go to the hospital and you spend a night or 2 or 3 nights there with the EEG equipment attached. It's the EEG equipment being electrodes which are attached to your head with a toothpaste-like substance, 20 of the wires to monitor brainwave activity. And we have a video running when the EEG is done in the hospital. This is important because it helps us capture and really characterize what the seizures are like. These are important for when children are having spells where we're not sure if they're seizures or not, especially if they're very frequent, like staring spells. We might wonder, is it a seizure, is it not? Or having difficulty characterizing them, that behavior arrest or decreased arousability. This is where a video EEG monitoring would be important. It can also be done as an outpatient. We might call an ambulatory EEG. This is where the EEG equipment is applied and the patient is sent home with it, maybe even with a video camera to capture their sleep to better characterize spells that we can't quite figure out if they're seizures or not. The other thing you'll do when you see the neurologist is start off with a good history. The neurologist will talk to you, really probing for questions about what the seizure was like and talk about things like family history, go back to birth history, trying to figure out if there's any epilepsy risk factors. He may want to order neuroimaging, CT scan or MRI. Now the decision to do a CT scan or MRI oftentimes depends upon what's available. If you go to the emergency department with a first-time seizure, often a CT scan will be performed. A CT scan is a detailed X-ray of the brain. It's not as detailed in the anatomy and structure of the brain as something like an MRI, but it's a fast test that's readily available in most emergency departments. I prefer doing MRIs, and this is what's recommended by the American Academy of Neurology and their practice parameters. It says if you're going to do neuroimaging, an MRI is preferred. The reason an MRI is preferred is it's much more detailed. It also doesn't involve any radiation. However, it's a longer test that for some people may require sedation, and then we'll often do this with contrast, which makes the MRI test more sensitive. The decision on whether to do other things like blood tests or a lumbar puncture has to do with whether or not you think the seizure came from another condition.